Good afternoon, dear distinguished participants. This is Abdul Talib, Senior Water and Sanitation Specialist from World Bank Dhaka office, is your moderator of this today's important session on gender equity and right. It is basically organized by our Bhutan team and with the supporting partner of UNICEF, FANSA and Water Supply Sanitation Collaborative Council. We have in this session the chair, Mr. Ranjan Wangge, Chief Engineer, PhD, Ministry of Health of Bhutan. We have the co-chair, Mr. Yuzin Ranjan, WASH Sector Leader, SNB Bhutan. And as I introduced myself, that I am the moderator, and we have the principal rapporteur, Mr. Sonam Gertram, UNICEF Bhutan, and Mr. Arif Abdullah Khan, Water Aid. In this session of gender equity and rights, we have 4 presentations, basically 2 from Bangladesh, 1 from Bhutan, and 1 from India. The Bangladesh presenter will present the gender mainstreaming in sanitation program for social transformation and empowerment by Rabia Sultana. Then the second Bangladesh sanitation budget tracking, a basic need for dignity count by Mr. Alok Mujumdar and Mr. Zubair Hassan. And the third one from the Bhutan, the role of women and sanitation and hygiene, a gender study from Bhutan by Testin Chodan, SNV Gender Inclusive and Governance Specialist. And finally, from India, the question of latitude and access, sanitation through a gender lens, Ruksat Hussain and Niti Saxena. May I take the opportunity to the chair of this session, the co-chair and the 4 presenters to come and dais, take their seat in the podium. Thank you, Chair, Co-Chair, and the 4 presenters. With the permission of the Chair, may I take the opportunity to conduct the session. Over to the Chair, Mr. Ranjit Wangge, Chief Engineer, PhD, Ministry of Health of Bhutan. Over to Mr. Wangge. Thank you.
Thank you. It's a little past 12, so very good afternoon to all of you. Ladies and gentlemen, welcome to the technical focus session on the theme Gender Equity and Right. In short, it's GER. One of the most observable divides between men and women, especially in developing countries, is in sanitation and hygiene, as we all know. The provision of hygiene and sanitation are often considered women's tasks. And today, as the moderator has announced, we have 4 presenters here who have done a lot of research. They have gone through the process of selection, and we're happy to announce that out of 10 or 12 papers, these are the 4 papers that has been selected. These 4 papers are exceptionally high in quality, resource-packed, and contributed by authors who have immense experiences in the area. I assure you that you'll not regret by choosing to attend this thematic session. Firstly, out of the 4 presenters, let me take this opportunity to introduce the first presenter, Ms. Rabia Sultana from Bangladesh. The topic of our presentation is Gender Mainstreaming in Sanitation Program for Social Transformation and Empowerment. Let me give a brief background on the author. Rabia is in the field of capacity development for the last 20 years and started working with GWA in April 2015. Prior to GWA, she has been with Dhaka Asahania Mission, Action Lead Bangladesh, Handicap International, Save the Children, CARE, and Government Food Security Project titled FSBGT. She is also experienced in working in gender and developmental contexts, both theoretically and practically. Her particular interest in the service provision that promotes transformations in marginalized people, including women's life with experiencing of development interviews. With this short introduction, may I now request Ms. Rabaya Sultana to take the stage.
To be here and present before you the experiences. A little correction here that the paper is being presented by me, but it is developed jointly by Max Foundation, particularly the program manager Mr. M.M. Mahidul Islam Kajol and me jointly developed the project. For some other high priority, he's not here. That's why I'm going to present the paper. So before going to my paper, just I'd like to mention one thing. It is undeniable that sanitation interventions are vital for women, not only for human health perspective, but also for socio-economic development for the nations worldwide. So before going to my presentation, I'd like to introduce about my organizations and the project particularly. That I'm working for Gender and Water Program Bangladesh. It's a project that implementing by Gender and Water Alliance. This is an international network. It's a member-based international networks who actually working for mainstreaming gender in policies program and development initiatives for the water sector. We have in the world, we have almost 2,200 members, and definitely 30% organizations and 70% are individual. As is Gender and Water Alliance, so we have 45% men and 55% women membership, both at organization and individual level. And in Bangladesh, we have more than 200 members. Now, particularly the program is actually co-financed by the Embassy of the Kingdom of the Netherlands. I'm very pleased to announce that Mr. Mike Slotema, the representative of EKN, is here, and I'm really feeling delighted to present before him. So, and this project is basically support the civil society groups, water professionals and government organizations in Bangladesh to adopt and implement a gender mainstream strategy in the water-related policy and practices. As part of this project, we are actually, the Gender and Water Program Bangladesh supports particularly 10 water-related projects funded by the EKN. And if I name few of them like Brackwash, Maxwash, the Blue Gold, Delta Plan 2100, these are few names of the projects that Gender and Water Program Bangladesh supporting them technically and advise them to mainstreaming gender across the program. So if I now go to the main paper, that the technical support that Gender and Water Program Bangladesh has been providing to the whole programs, to the organizations, is understanding gender empowerment approach as a whole. I'll talk later about it. And the participatory and actor-oriented gender related interventions, including capacity building and developing, supporting them to develop gender indicator for their monitoring and evaluation purposes. Regarding the Maxwash, I have given a little highlight here. The full name of the project is Max Value for Years. That is also a Netherlands government funded project which started in 2012. And the experiences that I'm going to share here is based on the experience from Borguna and Patuakhali. The project started there since 2012, and there are a few highlights there that Max was actually from their thirst of inception, when they started in 2005 with the motivation of reducing child mortality, and it is integrated the WASH approach. And the program has many other components like SAARC and safe motherhood promotion and many other components. So I have given one example here, and on the right side, if you could see that there is some promising information in reference from the BBS from 2012 and 2013, like the coverage of improved drinking water is 97%, and there are few other. But I'd like to mention here, this information, if we really reflect them critically, then there will be a question come forward whether if we really consider the equality, the inclusion approach, whether the women, the children from different marginalized community have actually represented here. So regarding the Max-Wash approach that throughout my many research and intensive field visit before developing the project, the learning that I have gained from here, and I'd like to add one thing that the representation from Max Foundation, the country chief is here, so in the open discussion session you can ask detailed questions to him, and I'll refer to him. So from my understanding, as per
it was an excellent presentation, and I think the project has involved the women right from the inception of the project till we can also look at the impact that it has generated. Without much discussion, I'd like to request for your questions, if you have. Make it short questions, but to the point. Let me kind of identify three persons.
I'm Bedman from Afghanistan. Thank you for interesting and nice presentation. I have just one query about the. In this project, there are a lot of things to do, and then you are working in physical, socio-economic, physical, economic, and political, and socio-cultural engagement also. In the gender, in any project,
that why we are doing WASH, and who will do the implementation, and how it gives the result, and who are benefiting. So if you consider the contrast of this requirement of WASH and the benefits of the WASH, then of course it gives the relation that how the women are engaged, because women have a particular role in the WASH development, and also they are the key holder of WASH, but it is understood that it should be the man also play a specific role, and it gives the vice versa result. It gives a kind of contrast on the whole outcome, that the man plays a good role, also that do by the woman. And empowerment comes on this way, that women are leading the decision making, and this decision making also makes an outcome in the family as well as in the community. And the empowerment also to political, because local government are very deeply engaged with these all activities, and local government usually what do they mostly are men, and few are women leaders in the local government. The decision always depends on the male leaders. In that case, the empowerment is that women take decision and local government support them. They back up them. That's how the political issues come, and it takes to the further outcomes, and also engagement with the health and nutrition issues, because health and nutrition issues are mostly helping to give the more better outcome on WASH. And nutrition is directly linked with WASH issues, and also SRHR are also linked with directly WASH issues. So these two part also gives a better outcome for WASH. That's how it goes. Thank you.
Well, thank you, Riyad Bhai. The last two question was almost same.
Assistant, please go, I am coming late. And then assistant stood up to present his theory of relative gravitations. And in the meantime, Albert Einstein came in, and already presentation going on. And then any hard questions came in, they say, okay, it's a very simple question, my assistants can answer this. He was in on the audience. So it is like me, any hard question come in, the champion, I would like to request Mr. Jobai to stood up. He is the champion of the budget tracking. He has been working for the budget tracking for a long time. We jointly wrote this paper, and any difficult questions, easy questions comes, yes, my assistant is there. We will be responding. Thank you very much, and I'm coming to my presentation. This paper is being written by both me and Jubair Hassan. I'll be strict on my time on this. Let's talk about my organization, WASH Alliance. WASH Alliance is an international consortium of the Dutch organizations working in 9 countries, including Bangladesh, and mainly focusing to enabling the rural women and also disadvantaged people, marginalized people, to ensure their rights. And DORF is a development organization of the rural poor. It's a leading national NGO and working for empowerment of the rural poor, especially to the women, so that they can raise their voice, they can ensure their rights. And they're also working on budget tracking for a long time, and they're being appraised by the national bodies internationally for this. And so DORF is very good organization. They have received UN award for the work, their good work. Let's talk about the budget tracking. What is budget tracking? Budget tracking is an initiative which helps the reality and to see how budget is allocated. Means they want to see how is budget is allocated from the central and how is going to the field, and how the peoples are using these budget issues. So budget tracking means from allocation to utilizations, they're tracking the process, how it's being spent, and how local government peoples are handling this budget, especially focusing the WASH. As I said, this is I'm sorry because perhaps you can see this from the distance, but it's a process from the top, from the bottom. From the top, there's a government of in Bangladesh, the Ministry of Local Government Rural Development Cooperatives deals with the WASH issues, and they allocate budget from the centrally to the local government. At the bottom, you will see the local government. They are the key actors in implementing the WASH activities, and DORF is really focusing at the Union Parishad level to monitor, to see how the budget is going, how they're spending the budget, and how the money being utilized at the bottom level. And they're also encompassing the multi-stakeholder approach. They're inviting all the stakeholder service providers to come in on board and to facilitate the process so that the people can get and ensure their rights. So by this process, they are really impacting a very good result, which I'll be discussing later. And this is the working area in this Bangladesh map. You see that shadow area is the working area of DORF earlier. So they worked in 6 union of 6 sub-districts in Bangladesh. That is a pilot basis. They worked, and I'm sharing the result of this pilot. And the question is the approaches, how budget tracking is being implemented in the reality. The 4 approaches. One is campaign and promotion, and it's a very popular, and I'm sure that learned participants are aware about this. So they are doing a lot of campaign activities at the field. They are hanging the posters at in the community. They have miking, leaflets. They are also TV program. They are also having public meetings. So these are campaign activities they are doing at the and promoting the WASH issues, the budget tracking issues, so that the people can know their rights, and they can come to the local government, and then they can negotiate the government to ensure their rights. And then the WASH services monitoring. It was already partially told at the Union Parishad level. They are discussing with them that how the budget they are spending, where the budget is going, how people's participation ensured in this budget preparation process. And of course they are also ensuring the other service provider like Department of Public Health Engineering to ensure the other engineering departments, other social departments, they can come and they can support what the needs come from the community. And then lobby and advocacy, I think it's already understood. You know, what is lobby and advocacy? And they're doing it in the central level as well, they're doing it at the regional level, they're doing it in the country level. And lobby and advocacy bringing some good result so that people, the service provider can provide service to them. The wash budget monitoring is already told. They are doing this in the field. How they are doing, you see the pictures. Picture says this the campaign. They have a lot of informations, booklet, stickers, petitions. Petition means the people are coming to the local government and giving, submitting their needs and petitions. They also use flyers. So a lot of BCC materials they are using for this campaign. And then wash service monitoring. As I mentioned, they have also formed a kind of health group, and so they are also doing service monitoring with the other service provider, family health care.
Should have been the ideal situation like this. So I need to know what synergies has WASH brought in the process, and what initiatives did WASH do to make these ideal situations into the real ones.
Please, your introduction, please.
Your introduction, please.
I am Sonali Puri. I'm a civil servant in Punjab, additional deputy commissioner in my district. Thank you.
Yes.
Next, please.
Thank you all of them for your nice presentation. I want to know that is there any involvement of women in budget tracking process to establish their WASH right? One thing. Second thing is that you have mentioned that WASH budget increasing. There is WASH, water, sanitation and hygiene. So which part increasing more compared to the three components of WASH? Okay, thank you.
As manager program support for the WASH programs at IDE. My question was that the data given was very beautiful, but the trend shows that after 2012-2013, the budget allocation went down, and also especially in Kuliar-Char, the per capita allocation also went down. So what is the challenge that actually basically contributed to that downfall in those areas specifically? Thank you.
Thank you for all the questions. Now may I request the presenter for your response. Yes.
Okay. So I'm not going to
convey the information to the community, I mean health village groups, that if we don't wash your hands, so what is the problem with the family? So this kind of massive promotion campaign issues we have conveyed to the community, and at the same time health service groups, I mean wash monitoring through the service providers, we have made them accountable to them. So
okay.
Thank you very much.
So thank you very much. I'll take 30 seconds from the chair. And at the end, I will convey my regards to Dutch Ministry, which is
if I must say, of how we need evidence from the field to influence our decision makers. So my presentation is titled The Role of Rural Women in Sanitation and Hygiene. And in Bhutan, SNV Bhutan works very closely with the Ministry of Health in our rural sanitation and hygiene program. So this gender study that I'm presenting today is actually part of this rural sanitation and hygiene program. Just to give you a snapshot of the rural sanitation and hygiene program in Bhutan, it started as a pilot phase in 2008. And it extended to 2 districts in 2010 to 2013. With the successes of the previous phases, the Ministry of Health, SND, and the GNH Commission, which is the Planning Commission in Bhutan, agreed to upscale this rural sanitation and hygiene program nationwide as part of the 11th 5-year plan of the Royal Government of Bhutan. And at the same time, in 2014, We got funding from the Australian government to upscale this rural sanitation and hygiene program activities nationwide. So, one of the key outcomes of this 4-year project is improved gender equality, stressing on the significance of ensuring gender equality and the need to make sure that we talk about gender in this 4-year project. Additionally, the 11th 5-year plan of the Rural Government of Bhutan, it targets for a more gender-friendly environment for women's participation in development, thereby underscoring the national commitment to gender in Bhutan. To give you a brief background on how this gender study came about, I think it's also important to tell the audience here a little bit about the current gender situation in Bhutan. If you look at documents with regards to gender in Bhutan, you'll see that it's mentioned that women in Bhutan do not really suffer from overt discrimination, or that women in Bhutan are on equality or they're on par with men when it comes to gender. But this does not mean that women in Bhutan do not face challenges. I must say, based on my several years of experience working on gender in Bhutan, that Bhutanese women do lag behind, especially in areas of politics and decision making, in tertiary education. These who were in charge of this masonry training, and these were not women who already had skills. So these were new women who were interested in it.
I think that's it for this session. Over to Jay again.
I know people wanted to ask questions. There are a lot of people here who really want to ask questions on this topic, but I think due to time constraint, let us just keep it to 2, but this does not necessarily mean that you can't ask questions. Please, you can talk over the lunch with Sri, so I'm sure she will be happy to answer your questions. Last but not the least, let us have a presentation on the attitude or access. I think this is talked about. We have seen people, visitors, even in the forum yesterday and today, talking about the access, whether it is really to do with the attitude. Why are people not constructing toilets? Is it to do with financial constraint, or is it they are not prioritizing? So probably this question would be answered by this through this presentation. To present, we have Mr. Ruksat Hussain. He is from SM Segal Foundation, Gurgaon, India. Mr. Ruksat holds a master's degree in human rights from Aligarh Muslim University. He started his professional stint with this Search and Care Foundation in Uttar Pradesh, India, following by working for various grassroots organizations located in northern parts of the country in India. So his experience varies from project implementation, especially in the field of education, to monitoring and evaluating impacts of development programs at the grassroots levels. Currently, he is a senior research associate at the research center of SM Senegal Foundation. So without wasting much time, I think this...
First, thanks to SACOSAN to give me an opportunity to present my findings. It is my first international conference, so I'm a little nervous. I'm working with Segal Foundation, which is working in 3 different states, Haryana, Rajasthan, Bihar, in different aspects like agriculture, water, and governance. Now I'm presenting here a case study of a district of Haryana state, and I'm trying to finding through my study is sanitation is the question of attitude or access through a gender lens. I will discuss background. In background, sanitation scenario in Indian context, study objective, methodology, or geographical area, major findings, and way forward. I would like to use some Hindi sentence so that I can convey my findings effectively. ग्लोबली अगर हम देखें तो इंडिया में हर 2 में से 1 इंसान ओपन डेफिकेशन करता है और as per the joint monitoring report 60% of the population is still in 60% of the population living in India who defecate globally. And as per the census which is conducted by Government of India in 2011, 53% Indian population still do not have own toilet. And when during the literature I found that diarrhea is the main cause due to sanitation, open defecation, and 1,88,000 children every year due to diarrhea death हो जाती है उनकी हर साल इसमें। और एक दूसरा ग्रुप है जो women का है, तो they are also facing lots of problem. Like they wait for diagnosis to go for open defecation, and they some case are like they rape so many times in India because they go open defecation in darkness, and they also drink less because they बार-बार उन्हें जाना ना पड़े उसमें open defecation के लिए। And there are many initiatives taken by the government. Actually, sanitation को कैसे improve करना है, ये इंडिया में pre-independence से बात होती चली आई है। The father of the nation said that sanitation is more important than independence. And in 1986, the first initiative was taken by the government, the Central Rural Sanitation Program. It was only supply-driven program. Government of India provides subsidy to poor people to construct the toilets. But after a decade, government realized सिर्फ टॉयलेट बनवाने से कुछ नहीं होगा, लोगों की डिमांड होनी चाहिए, फेल्ट नीड होनी चाहिए, देन टॉयलेट बनवा के फिर वो यूज नहीं करेंगे। तो in 1999 the program was launched total sanitation campaign that was supply driven and community led program. In 2012 Nirmal Bharat Abhiyan was launched which was
because it's 2 different states in then Haryana and another I forgot.
Other one is district Mewat, which is come under Haryana.
Even if you speak Hindi, I can understand a little bit. Thank you.
Looks like that is not a really question, but just a clarification. So next, please.
I'm Radhika from Sri Lanka. From all 4 of the presentation, it was wonderful. And as a general question, what are we going to recommend to the SACOSAN on regards to gender equity and right?
Monitor these impacts. I think they will go a long way. And with regard to sanitation budget tracking, looks like there's a increase in trend of budget, but looks like water is taking bulk of the budget.
So we give a big clap to the chair and co-chair. Thanks and appreciation. The presenter did a very good job because they have analyzed all the field facts and how the gender equity and rights can be established on throughout the sanitation. That is another good things for us. We have something so may I take the opportunity to call on the stage Mr. Carol de Groot to come over here to give some memento to our chairperson, co-chair and the presenters. Mr. Carol de Groot of Dutch Embassy, Royal Dutch Embassy. And finally to me for this. So thank you all. Now our next session is lunch. Please go for the lunch. Thank you very much. So good.
I'd like to introduce you to our chair, Professor Dr. Ashraf Ali, who is the Professor of Civil Engineering in Bangladesh University of Kuwait. And he's also the director of ITN. ITN is a network for water and sanitation. This afternoon we have two presentations. The first one, sanitation strategies, enhancing reliance to climate change. That will be presented by Dr. Bisit, who is just here. And the next one, water is life and sanitation is the way of life. That will be done by our friend Mr. Anwar Kamal. They will introduce themselves before the presentation. Now I'd like to give the floor to our chair.
Good afternoon once again. Before we go into the session, there are some rules. Originally there were 4 papers for this session, but only 2 presenters are present here, so we have some leverage with respect to time. The time limit was 15 minutes, very strict, but since we have only 2 presentations, I think we can, we can relax a little bit with regard to time, so I would not force our presenters to finish their presentations in 15 minutes. They can take their time. And after the presentation, after both the presentations, we'll go for the question and answer session. So we can now start the presentation. Our first presenter today will be Dr. Bisit. He will present his paper, which is titled Sanitation Strategies, Enhancing Resilience to Climate Change. Please welcome Dr. Bisit.
Thank you, Mr. Chair. Center for Good Governance under the Department of Personnel Training, Government of India. In fact, this organization is very new. It's a new baby organization. It has been recently set up by the Government of India in 2011, in fact. It was inaugurated by our former Prime Minister, Dr. Manmohan Singh. And previously it was known as the National Institute of Administrative Research, which was an research and training wing of Lal Bahadur Shastri National Academy of Administration. It is situated in the northern part of India. It's also situated in the Queen of the Hills in Mussoorie in Uttarakhand state. I know most of you know about the Lal Bahadur Shastri National Academy. It is basically the training organization, training institute of the Indian Administrative Services. All the newly recruited IAS officers, they trained in the Lal Bahadur Shastri National Academy of Administration in Mussoorie. And I would like to add some more information. The Cabinet Secretary of Government of India is chairperson of our organization, and the Secretary Department of Training and Personnel is the vice chairperson of our organization. And all the secretaries of various ministries, all the ministries secretary, they are the members of this organization. So in fact, as far as my presentation is concerned, I would like to share with you some information. Maximum 8 days back, I received an email from Mr. Jahangir from Pakistan that your paper has been accepted. I was very surprised. He has given me only 8 to 10 days to prepare the full paper. But I could not be prepared because since I am closely associated with the training organization, and we are imparting the training program in whole country. So that time I was in Odisha, so I could not prepare my presentation, my full article. Although here I am trying to share with you my little bit. We have done the work on the sanitation and the climate change. I would like to share with you whatever work done by my organization. As we all know that the climate change is the very burning issue, and I think that this is the first time in the SACOSAN history that we are incorporating the climate change into the sanitation sector. As I believe, I don't know that this is my first time in the SACOSAN, although we are imparting the training program for the sanitation sector in the Swachh Bharat mission in the whole country. All the district collectors because we have in India there are 636 districts. We are imparting the training program for the district collectors in various parts of the country. At the same time, we are also imparting the training program for the block development officers in the whole country. So, as I said that, I think I don't have any information about the past SACOSAN experiences, SACOSAN seminars, but I believe that I heard from someone that this is the first time that the climate change has been incorporated in the sanitation sector. As far as the impact of climate change are concerned, mainly there are four major components, major sectors. The number one is the precipitation, flood and storm, sea level rise, and increased temperature and drought. As you know that since I am from the Himalayan states, and there are Hindu Kush Himalaya, there are 8 major countries in the whole Hindu Kush Himalaya, from Afghanistan, Pakistan, Nepal, Bhutan, India, Myanmar and Bangladesh. In all together there are 8 states which covers under the Hindu Kush Himalayan region. There are in the large scale there are glaciers, and the glaciers, one scientific study conducted by the Ministry of Environment and Forest Government of India. As per the Government of India study, that they said that every year the large amount of glaciers are melting down, and as a result, the sea level is rising. And precipitation, flood and storms are the major other impact of the climate change in the sanitation we can incorporate, and increased temperature is another factors of the impact of the climate change, and drought. Within the 4 sectors, for each components, there are sub parameters as well. If you see the precipitation, flood and storm, there are flooding of sanitation facilities, drainage treatment facilities, possibility of contamination of water resources. And if you see the sea level rise, indexation of sanitation facilities, possibilities of contamination of water resources, and in drought, reduced availability of water, unable to dilute pollution affecting wastewater treatment facilities, and increased temperature as a result provide conducive environment for algal blooms and pathogens, etc. So these are the impact of the climate change. And if you see the sanitation scenario of India, still India is lagging behind, and as per the 2014 report produced by UNICEF, still India is lagging behind on sanitation sector, and 792 million people have still access to improved sanitation facilities in 2012, although the numbers has been little bit increased as per the data. And if you see the global scenario, 2.5 billion people have access to safe improved sanitation facility in 2012. If you see the vulnerability of the climate change, the World Bank study conducted on impact of the cyclone Helene in Odisha started that about 18,000 residents from 18 districts were affected due to disruption of basic infrastructure, especially for water and sanitation. This was the major climate change impact in the Bangladesh.
Instant to the hard to reach people, and how this technology can be intervened in the sector development plan. And my second question is to the first presenter. You showed about the experience of India. Would you like to clear the human-induced activities nor climatic factors are making more vulnerable the situation of climate change? That is my two questions.
Thank you. Let's take a gentleman over here, and then we go for first round of answer, I think.
Thank you very much. Thank you very much. My name is Aryan Ass from WaterAid. It's actually not a question but a contribution to the discussion. When we have a title like climate change and sanitation, many people don't know the link. And we also have to be very clear about where it actually is. I'll give you an example. Just now in Paris, there's been a COP21 about climate change and the whole world active about that. In that statement there was obviously no mention of sanitation. So we have to be clear how we're going to link it up. And it's obvious, for us it's very obvious, it's in the water cycle. And even water is hardly mentioned in the whole COP21. So one of my remarks is, if we talk about climate change and sanitation, let's be very clear. It is via the water cycle, either the lack of water or the surplus, which was very nicely, and that's one graph, I really liked it to see. Now my second question is more a question, is we're talking about hardware resilience of the actual infrastructure, but the social resilience is very important, and that goes via the hygiene awareness. An example is from the earthquake in Bangladesh, where communities that were previously declared ODF were sooner back to ODF than many of the others and had less problems, so because they were better organized. So let's also think about the software component, hygiene training. The simple solution sometimes possible when flooding is happening, put sandbags on top of your pits and on top of your pans to avoid them damaging. There are also some simple solutions, not always going for more expensive and more larger infrastructures. Thank you.
Thank you very much for the enlightenment. Let's take the first round of answers. Should we talk with Mr. Kumar?
First of all, thank you very much. In terms of costing, as you said, there is two types of toilet. One is the individual household, they are making toilet by themselves, which is owned by themselves, and they also made a plan. You saw that is the low cost. Because for the preparing the toilet, they needed some cents, and even in 3 pieces of the peat, and even in pipe line. So it is a very cheap. It might be cost like a 600 to 1,000 like that, which is done. You saw that it is a one area. There is another one which we prepared for the community people. When you say the community, when disasters come or cyclone come, they don't get any place for going to the toilet. So then what they do, they often defecated in the river area. Then we made a toilet so when any flood comes, they can go there places. It is almost cost like a 70,000 to 1,40,000 almost, like amount like that. But it is for the basically for the during the flood period, so they can utilize like that. But the piloting we did because of if they can see that after seeing that they can prepare by themselves with the very minimum cost. That is also idea because of we discuss with them about the cost you say. Regarding because of as Aryan said, we also provide them many training, awareness training. You'll be very happy to know that in that area they also made the road and they also made the bridge by investing their money after analyzing the flood situations or disasters when it's come. This is one. Regarding you said the raising septic tank, it is when we raise the, what is it called, infrastructure, you saw that we also raised the septic tank, so it is also raised accordingly. So it is when flood comes, it doesn't affect that much. This is you asked me. There is my NGO from colleague asked about that Bangladesh has identified the vulnerable area 114 because of we also water has also did one research work with the UST, that is we call it hot spot area. We did the research on that area that has been identified through us, and we also requesting to the government not to delivering only pitlet in there. So can you consider regarding the technology? We never say our technology is the only the solution. You can get the many solution, but we are also inviting the private sectors, even in entrepreneurs should come to help us. So because of that, we are also working together to promote the climate resilience technology. So that dialogue is going on in policy level. That we are also, even in Bangladesh is SDP plan, we are also put that issues. It need to be taken care very seriously on climate change area. This is the answer. You asked this question. Anything left? Sir? Cost I already discussed.
The latent reservoir, how that contribute to climate excellent sanitation?
Oh, okay. I already said because of it is some of the area we made between pitlet. One is upper level, one is lower level. When it's automatically when it's come or it's transferred to one place to other place, so it doesn't affect that much.
Is that the holding tank, or the reservoir that you're saying is about just only a holding tank?
I could not understand. I could not get his question.
Maybe we can discuss it bilaterally.
I could not guess it. Said bhai, you can also reply that because of I could not get your question properly because of it is not here to.
That tank, what I understood that Kabir bhai, my friend, also about reserve. Yeah, reservoir. It is a reservoir means water reservoir. Yeah, you know that this study was done in the Chor area, offshore Chor, and there is no electricity, no power supply. So we use magic pump to uplift the water. So it is called the reservoir. It is for the ministerial hygiene management system and running water into.
Said bhai, I have to give him answer. Reservoir is the top of the toilet. So when it is top of the toilet, it's a water tank. Sorry, I could not understand your question initially. Now, thank you very much. Please.
Okay, thank you very much. I am coming in the first question, measuring of the capacity building training program. I think Madam has asked. You asked, no? Okay. As far as the measuring of the capacity building training program of our academy, we have not only for the climate change, even all the training programs, multiple topics and modules are delivering by the various resource persons in our academy. We have certain mechanism to get feedback from the each training program and from the each resource persons. We have the categorized of to take the feedback like good, very good, excellent, poor and very poor. So 5 categories we have, and generally we take the feedback from all the participants and we just analyze in this statistical manner and then we send. And one of the major things in our academy that whoever the resource persons delivering his session or her session, below than
80% of the feedback. We never repeat that resource person till he assured that now I have the capability to deliver more than 80%. So this is the criteria of the measuring of the training program, the feedback from our academy for the various resource person and for the each training program. Number one. Number two, as far as the research studies are concerned, still our organization has not done any kind of research activities on the climate change sector. Although there are so many organizations in our country like Ministry of Environment and Forest, they are doing a lot of research activities and they are documenting best practices documentation and other related issues to the climate change they are doing. But still we are not doing because as I said that our organization is recently set up by the ministry, by the government of India. So we are looking forward to do the more research studies, many research studies. And thank you, ma'am, for your appreciation, and we look forward to work with your organization as well because our government of India is more focusing on the climate change issues. Thank you very much. Thank you. Anything else?
I am KBS Rob, Director, looking after persons with disabilities in Government of India. Basically, I don't want to ask any direct questions to the speakers because their really presentation is very good. Three comments or suggestions I would like to make. One is, I think the topic climate change and sanitation, probably as one of the persons have already commented. I don't think there's any direct measurement or relation between sanitation and climate change because there's so many factors which affect the climate change. Probably we are looking into what the impact of natural disasters on the sanitation. Probably disaster and sanitation, probably that probably not better natural disasters and sanitation. Probably that would have focused more on the issues. I think the content of what has been spoken is, I think, natural disasters and sanitation, what is the impact. Now, having said that, relating to the persons with disabilities, even in the normal situation, they face a lot of problems. And not only the disability is not just physical disability, it can be visual disability, it can be hearing disability, it can be autism, mental retardation. So many disabilities are there. And now, since the Sustainable Development Goals, in that the disability is linked to the development, I think whenever we talk about sanitation, we may have to give enough focus to the disabled groups in terms of while constructing toilets and making other sanitation measures for them. Now the third point is regarding the speaker from India. It's really good that the civil servants are being educated in this area. Probably it would be better if some study is done where these initiatives are happening, whether these initiatives are happening only because of the communities or because of NGOs or because it is directly or indirectly supported by the government, so that the best practices being done by certain states and districts can be emulated by the future generation of the civil servants. Thank you.
To my Indian colleague, I have a comments, opinion, from your presentation, we have found that in India there is a big climate change training center. Probably they are conducting many trainings regarding climate change issues. I have a opinion to you that if the training center and various research on climate change, and in that purpose, we like to request Indian colleagues to conduct a detailed research on river connection, as Bangladesh is lowland country in the context of India. How we are suffering the water crisis, as India is making different dams, dam and barrages. Such kind of research we have requested for that presentation. Thank you.
Any other questions?
Yes, sir.
Thank you for the presentation. Just a small question to the first presenter. Among the various modules that have been developed for your training program, is there one specific on wash or sanitation? And another question is, to what extent have the officials or government staff responsible for wash have been included in your training? You have targeted or you have already reached a large number of participants in India. So what is the proportion of officials responsible for water and sanitation? Thank you.
First question.
Module, specific training module on
Sanitation.
Sanitation or wash in climate change.
Thank you. As I said that we have the various levels of officers in an administrative service. So from the foundation to up to the phase 3. Foundations, as I said, that they are the very newly recruited IS officers.